So we've been delighted to be here today at the MS Trust Conference 2023, talking about how we can help people with MS who develop respiratory problems or breathing problems. We've been talking to a multi-professional audience, so there was doctors, nurses, physiotherapists, speech and language therapists in the audience, really looking at some of the signs and symptoms and also how we can help people with MS. Respiratory complications are really common, but often they go unnoticed. So we kind of think of two separate situations. One is where a person might have obvious respiratory symptoms or complications. So they might be short of breath, they might have a weak cough, but we also have other symptoms which may occur during sleep, or they might not feel as hungry through the day, or they might feel a bit sleepy or fatigued through the day. So as clinicians, we really want to talk to the person about what their symptoms might be and if we can somehow link it to respiratory problems or complications and how we can assess and treat that.
So the sorts of things that can be done about respiratory problems in MS, well, the first point of contact really is to talk to one of your MS healthcare professionals. The first stage is about recognition of your symptoms and perhaps talking to one of your healthcare team. That might be a doctor, a physiotherapist, an occupational therapist, your MS nurse, and they can help tease out those symptoms with you and perhaps refer on to onwards to a respiratory team. In the meantime, there are lots of other things you could think about do to help to maintain your respiratory health, and that might be just remaining as active as you possibly can within the limits of your fatigue. There are certain exercises we could look at prescribing for you. So your physiotherapist might prescribe breathing exercises, your speech and language therapist might provide exercises to help with your voice projection and your swallowing. And there are other things available online such as singing and Tai Chi exercise classes, which can also be maybe appropriate for people living with MS too.
Well, there's a huge wealth of resources available on the MS Trust web pages. I think looking at postural support and how you're sitting is really important. So there's a good resource there. Exercises are going to help stretch your lungs, get you out of breath. There's a really good resources there. And depending on your level of ability, there are seated exercises, there are standing exercises on there. And things are a little bit more specific to lung health. The therapists interested in MS on their professionals page have just launched a document with some really useful resources on specifically breathing, or specific breathing exercises like breath stacking that you could look at with your physiotherapist together and see what's going to kind of be most useful for you. Because I recognise that it's great there's so many resources out there, but sometimes having someone navigate and talk those through what's going to be the best fit for you, where's the best place to start, can be really helpful. So ask your healthcare professional to have a look at that webpage with you.